everybody, it's Liz. I'm back. I'm with pink hair. In case you really didn't notice, but I know you did. So I haven't done a video in a while. I've been busy last month doing my awareness for EDS. And I was doing an alphabet, which I think I'll post on here, the entirety of it, just so you can see it if you want, within a video. But my video today is something that I know a lot of people with chronic health, especially EDS, suffer with, and that's weight loss. Like, if you've been following my channel for a while, you notice I put on weight. Obviously in my face, this is actually partially due to not only weight gain, but I have a parathyroidism, hyperparathyroidism. So that's currently in process of getting looked into. The endocrinology team are dealing with it. And also my Sjogrens, I tend to swell up in my face a lot because my glands get very swollen and things like that. And since I had the first COVID vaccine, I had a really bad reaction with my Sjogrens. So, but I was fine. So, it was just the side effects, not an actual, lasting effect. So, so with my weight loss journey, it's been very up and down since I was a teenager. Mostly it's usually linked to my physical activity. So in the past, before EDS, I used to run a lot and swim a lot. And then obviously I got a lot of injuries with my EDS, so I stopped running. And then my POTS got worse and I couldn't go swimming because I would often go on my own. And now that my fainting is a lot more recurrent, especially if the pool is very hot, well, not the water, but the actual atmosphere. A lot of pools won't have you there because they don't want to run the risk of you like fainting and drowning or anything. Also, my husband can't swim, so if I go with him, he can't save me. And I have begged and pleaded for some kind of hydrotherapy, physiotherapy, any form of exercise where someone medical can assist me, but so far, nothing. Obviously, we've been in a pandemic, we still are, and last year, pretty much 0 appointments happened for anything really, especially physio, weight loss, stuff like that. So my weight's always been up and down. I've been on so many diets. I've tried Weight Watchers. I've tried all back in the early 2000s. There was like so many fad diets. Like I think I tried like the soup diet, the South Beach diet, the there was so many books that would tell you what to eat. I can't remember what it was called, but you had loads of protein and no carbs and you had stinky breath. I can't remember what it was called. The Atkins, that was it. The Atkins diet was very popular. Then I lost a lot of weight with Weight Watchers, but then went to uni and put it all back on. Then I got really ill with mumps and lost the weight and then put it back on again slowly when I moved to London. And then I took up running and lost it. So it's been up, down, up, down. And then before I got married, I was on a healthy eating diet. That was really good. I enjoyed that. So it was a tricky one. But then I put on weight after the wedding. Then I ended up really ill 2019 with my colitis, which we now know what that was, and I got C. diff. And I lost some weight, but what was surprising for me is I had 2 solid months in hospital where obviously your food is monitored, well, not monitored, but like you're given it. So, and I was so ill that most of the time I couldn't eat because I had a severe bowel infection. So I had really severe bowel issues. And at the end of all that, I'd only lost 5 pounds. And that was shocking because any kind of regular, normal person probably would have lost a lot. In the past, like 10 years ago, when I first got my gastroparesis diagnosed, I was in hospital 2 weeks and lost a whole stone, which in American weights is like 14 pound in just 2 weeks. And now in 8 weeks, I only lost 5 pound. So it doesn't make any sense to me. And I know for me, my bowels have been tricky, especially since I've had to adapt my diet a lot. I have mast cell activation disorder, so I'm on a low histamine diet all the time. That's like a permanent thing. I was on FODMAP, which is an elimination diet. And I can't have dairy. I can't have eggs. I can't have so many things because it affects my bowels. And then after my bowel infection, they confirmed I actually did have colitis before that, which they completely, like, all the tests said every time it's colitis, but they were like, no, we don't believe it. I don't know why. So yeah, that was really tricky. So since then, I've just been kind of fumbling along on my own, not knowing really what to do. My gastro doctor in London put me on a low histamine. I've been on also low residue because of the colitis. There's a lot of things that are the same for me. So like tomatoes really upset my bowels, but also give me really bad allergies in my mouth. So that's the Marcel side of things and the colitis. I get like sores around my mouth and my tongue gets very sore. And then I get ulcers in my mouth and I get very croaky and wheezy. So it's really quite unpleasant. It's never gone full anaphylactic, but hopefully it never will. But it's not an intolerance, that's an actual allergy, because a lot of people get allergies and intolerances confused, because an intolerance is something that you don't have an anaphylactic reaction to, but you can get some really severe symptoms like dairy intolerance. Like it's as bad as colitis for me in symptoms. And then an allergy is something where it's defined, the typical allergy is anaphylactic, but obviously that's the worst end of it. But the mildest end is something like hay fever, because you're allergic to pollen. Obviously, a lot of people have blood tests, and it's IgA mediated response. I think that's technically what it's called, but my blood test showed that I didn't. But then my Sjogrens that's how you test it, and the only one they diagnosed it was with a biopsy of my skin, and in my skin it showed I had it. So, because I have all sorts of reactions in my skin, in my bowels, in my mouth, in my stomach, everywhere. So losing weight's not easy, and I've had a lot of surgeries as well with EDS. Like, it's not actual joint surgeries, but I've had I've had my gallbladder removed, my appendix removed. I had sinus and nasal surgery 4 years ago. I've had various different injuries where I've not been able to weight bear. And as a result, you get deconditioned and it's harder to then get back into exercise. But also, for me now, I have small fibre neuropathy and I have no feeling in my feet. So it's not like I can just suddenly do Zumba or Pilates or something, because I can't feel the floor. So it's really dangerous for me. And I don't want another injury, because that would be even worse. And I'm already outside of the house. Like, I have to use my wheelchair now. So it's tricky. So I was with a dietitian for a while. She was really good. But then with all my allergies and stuff, it's kind of like, oh, they kind of give up on you. And then I was referred to the weight loss management program at my local hospital. And I think I waited 2.5 years to get on their books. Mostly due to COVID. Obviously, there was a whole year where they weren't accepting referrals. But I was referred in 2018, I think September 2018. And I didn't hear till February this year, 2021. So that's 2.5 years. When I first joined, they phoned me and they were like, right, we'll put you on a shake diet, like a protein shake diet. And I said, that's great. I was like, so long as there's no oat fibre, because a lot of these vegan protein powders have oat fibre, and I'm majorly allergic to oats. Bad. Like, I say allergic because I get vomiting, diarrhea, cramps, bleeding from my bowels. Like, it's really bad. And it affects my throat as well, because the acid in my stomach goes into overdrive and then I start choking and it's not good. So they said that I couldn't do it because I had to have soya milk with it. And of course, I can't have soya. So I usually just have almond milk with everything, cooking, cereals, baking, anything like that. They said almond milk didn't have enough protein in it and calcium and stuff, but that's a whole nother story with my calcium levels at the moment. So then they said they were going to bypass that and put me on the plan that would be the next step for someone who'd already done the shake. So it was a calorie controlled, restricted kind of diet. They started me originally back in February, and basically it was a menu. You get 4 choices a day. It's all worked out to your own personal height, weight, age, physical activity level, all that. But I noticed it was very carb based. There's proteins and carbs, and I was very confused because all other diets have been more restrictive of carbs, especially as I definitely put on more weight when I have carbs. But sadly, with my colitis, the only thing that it likes is carbs. So if I'm in a flare, the last thing I need is to have something aggravate it. So I do feel sorry for the dietitians because they have to do a low histamine, low residue, and can take into consideration all my intolerances and allergies as well. So, so they sent me a plan that was basically useless because it was all things like whole grain fibre, high in fibre, beans, peas and lentils, all that stuff. And I was like, oh. So I went back to them and they said I had to email them a list of all the food I can and can't have. So the can't was very long and the can was not as long. They came back eventually with a menu plan, but I had to wait over a month. So bearing in mind my goal was by a certain date I want to get to this goal, that was thrown out the window. Then I had to go back to the hospital to be weighed, blood pressure, blood test, which I don't know why I couldn't have that done at my GP surgery. But for me, with my POTS and my EDS, it's not always possible to get to the hospital because I have to drive there. I could get patient transport, but I've had such horrific experiences that my anxiety is through the roof. I would actually have a panic attack doing it. I'm even thinking about it. I feel, bad experiences. So I drive myself there, but I'm not always well enough to drive and my husband's at work. So especially just to get weighed, I could do that at home. It's insane. So then they agreed I could go to my GP surgery to get those things done. And all my appointments have been on video, so nothing in person at all. They sent me a revised menu, which was better. And they sent a whole load of things like goal setting and filling things out, why do you want to lose weight and all this stuff, which, to be honest, I found a load of rubbish because I've done all that before. I know why I want to lose weight for my own health benefits. And they really hadn't listened because then I've been on the phone to them today. They put things like Weetabix in there and whole grain stuff, which again, I'm like, I will not be able to eat that. And for the first week, I actually followed, even when they said about the vegetables, and it took about 10 days to feel better because I had severe diarrhea every day for 10 days because of the vegetables, which I knew would happen, but I just wanted to prove a point to them that this is what happens. It's not something that I'm making up. So there you go. So I've been on the plan now 3 weeks. I've lost absolutely 0 pounds. I've stayed exactly the same. I haven't put on, which is good, but I haven't lost anything. It's a very boring plan and I hate it. There's no flavour, because my diet is quite restricted. What I usually would be able to have, I can't have. They're okay, but you get the impression that they're like, oh, she's being really difficult, when I'm not. I don't want to end up in hospital with bowel problems, especially not at the moment with COVID still being around. So I'm stuck because they don't really understand. And even last time I had a consultation, they didn't seem to know I had colitis. And then today she did. And she said, well, what treatment am I having? And have I been on a special diet for it? And I was like, well, nothing, because I was diagnosed, supposed to have a colonoscopy again last September, but then that was cancelled because of COVID. They're only seeing cancer patients, which is fair enough. And then it hasn't been rebooked, and I've got a video appointment with gastro in July this year, which is next month. It's just frustrating, because also a lot of these doctors focus on numbers like weight, whereas in the past when I've lost weight, I've lost a lot in inches, like measuring. But when you go to a doctor and they weigh you and they're like, oh, you're overweight, and they do your BMI, your BMI is not very accurate, because it's based on somebody of your age and height and weight. But the BMR, the basal metabolic rate, I learned about when I was studying nutrition, and that's more accurate depending on loads of things. You'll get like a rugby player who's super fit, but is like 6 foot something and weighs about 18 or 19 stone. Now, they're deemed to be morbidly obese, but they're not, because they are all muscle. But because their weight's higher, that's why the BMI is high. And I'm just like, that makes no sense. Because also what gets me is that all of my blood tests, except my vitamin D and my calcium, are normal. Like, completely fine. So there is nothing wrong that side of things, except that I'm overweight. So I don't know what more I can do. And also, I want to exercise. I've been asking my GP and my neurologist for the last year, please can I be referred for some kind of physical therapy to get me going again that would be okay with my numb feet. So like hydrotherapy, physiotherapy, like I said before, nothing. So they kind of on you to lose weight, but they won't do anything to help you lose weight. Because a lot of doctors do that. They point the obvious, like, oh yeah, you need to lose weight. And you're like, well, are you going to help me then? Because they don't want to spend money. And actually a lot of people don't know that in the UK, GPs can actually do social prescribing, which is where they can say on prescription, so for free, they will refer you to, say, 6 weeks of swimming or 6 weeks of an exercise class. And then after that 6 weeks, if you like it, then you have to pay it yourself. But it's to try things out. But a lot of GPs won't tell you they can do that because, again, it costs them money to do it. But then in the long run, surely it will cost them more money if you're overweight and have health problems because you're overweight. So it makes no sense to me. I've tried everything. I know if I exercise, I will lose weight quicker and more efficiently, but I have no help. I'm screaming out for help and nobody wants to help. So, like, do I just accept I'm going to be overweight forever? Like, I know I'm never going to be, like, stick thin. I never have been. But I want to lose a couple of stone at least. Yeah, it's like, hello, I'm here. I'm asking for help. And they're not helping. So, I don't know. I will do updates to let you know. But hopefully people watching this realise you're not the only one out there who feels like this and is struggling like me. So yeah, so that's it for me. I am going to chill. It's a warm day today in the UK and my POTS does not like that because my heart rate goes crazy and I get a headache. So I'm going to stay cool and I'll speak to you soon. Bye.